Hello and welcome to all of our Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here I have a special guest with me today. Today with me here is Kimberly Bepler. Welcome, Kimberly.
Well, hello.
Wonderful to have you here today. And Kimberly, you are one of my favorite people as a midwife. You are a doula, and I love and adore doulas and all that they do. So welcome. I'm so happy to have you here. So before we jump into the presentation that you will have here at Gold with us for our add-on lecture pack on the newborn, let's first of all find out, where in the world are you?
So currently I'm near Phoenix, Arizona, although most of my life I was in the Northwest, and that's where most of my practice and the little babies that I adore are.
Wonderful. Thank you for sharing that. So tell us a little bit about your background and your work. As I mentioned, you're a doula, but you're so much more. So talk about your wonderful work and all that you do.
Yeah, I began as a doula just about 22 years ago. And I love being a postpartum doula. It was the highest calling of my heart. But of course, as you start to work with families, you start to realize they need a higher level of answers a lot of time. And doulas have time. Doulas have invested time with them longer than a lot of the practitioners they see. And so the more I could build knowledge, the more I could be helpful. So I started pursuing lactation and eventually became an IBCLC, which is great honor and lovely part of my life. And then I also became a new parent educator, and I learned to teach lactation classes and also do new moms groups. So over the course of the years, I've added every few years a new kind of focus. And then I also train doulas and other new parent educators and lactation educators. So that's been lovely.
Beautiful. It's a full circle. You start with birth before pregnancy and birth, and then postpartum doula, IBCLC, so important, getting the little ones and the families off to a good start in breast and chest feeding. And then also training doulas and teaching, early parenting classes. That's absolutely fabulous. You give them the full program there, so to speak. So yes, you are part of our add-on package. The package is titled Clinical Tools for the Changing Landscape of Newborn Care. And this is an add-on package to our Gold Midwifery Online Conference of 2023. And your topic is Understanding Infant Crying. So tell us a little bit, how did that happen? How did that come to pass that crying became such an important topic to you, and that you became passionate about teaching families on crying and understanding their infant?
Yeah, I really have a passion for helping parents to know their babies. And of course, as a doula, you get a lot more calls for parents who are struggling, who don't know what's happening. They're pulling their hair out. They're saying, no one taught us what to do. How do we help? And why is our baby so unhappy? And so my heart as a provider is not just to soothe that infant, although I have a strong desire to do that too, but really to teach that parent, what is it that the baby's trying to communicate, so we can meet the need and not silence the cry, but really hear that communication and respond. And that's just always been a big part of my heart and my life. And when I have given parents the tools that I teach in the workshop, it really teaches them this confidence level of, I know my baby, I've got this, like I can advocate for them, I can meet their needs. And that's bonding, right?
Yeah.
We can meet our child's needs. We feel good about the baby that we were given and the parent that we can be. And that makes the world a better place. So that's why it's important to me.
And it is. And you mentioned something very important, giving parents the confidence. I remember myself when I became a new mom, and that was before my career as a midwife. My first daughter, she was crying a lot, and I felt so helpless. I felt, that I wanted to help her. I wanted to see, and I felt like such a failure, and there was nowhere to turn, and having had the tools that you're teaching the families that you provide would have been so incredibly helpful, because I felt like I failed as a mother. I can't soothe my own child. What good am I? And I know many parents feel that way, and it doesn't have to be that way. So it's good to have that education. Let me ask you this. I mean, the internet and social media, it's a great place to connect, especially during the pandemic when people could not see each other in person, but they could reach out to each other. But it is also dangerous. I feel like when you see those Instagram posts of the perfect baby, the perfect, little bundle of joy that's just sleeping there, and the parents just blissfully look at the baby. You've seen those pictures, right? And it doesn't show reality, though, right? Isn't that, um, what does that do for no parents? That can be so difficult.
I think the standard right now in parenting is that if you do everything right, your baby will always be happy and always be healthy and perfectly grow, and breastfeeding will work just great. And
Right.
although I love so much about what social media provides, this Pollyanna view of how babies are going to be is not serving them well. It's making them feel incredibly guilty and not worthy of being parents to these tiny humans, when indeed the parenting standards have heightened and heightened and heightened and heightened over the years, instead of relaxing more and more, saying we're all just doing the very best we can with
Right.
these challenging little
Yeah.
people.
Yeah.
So I really do think it's done damage, all, alongside with some of the education that is provided to say, this is how much babies cry, and here's some
Right.
ways to soothe babies. And I can use social media to show them. I can pick up a baby and soothe them and go, try this. So
Try
it's a
this. Yeah.
wonderful tool, but the
Mhm.
standard that it's set for this perfection is just, it's unreachable. And
Yeah.
it's unfair.
It's unreachable. It's unfair. It's so much pressure to these families as well, because they're sleep deprived. They're recovering from birth. Maybe even it was a traumatic birth, or if it was a C-section, they still have a lot of healing to do, and then having these standards that are just not reachable. And also, I think us as care providers, we need to do a better job to teach really what is normal infant behavior, right? Infants cry. That's their way also to communicate. So I think, how can we do this, Kimberly, that we do a better job of teaching our parents what is really normal infant behavior? And
yeah, somehow we have to get over prenatal families not wanting to hear about this.
Yeah.
Because they really don't want to be told that it's going to be hard. So I really find, as an educator, the best way to focus is to give them the tools to say, here's the range of what's normal. Here's the tools that you need. Build your tool bag now. Have that as a safety net. If you're on that wire balancing and it's perfect, great. But you build a safety net and you fall and it will catch you. So that's the best way I can teach parents without making them feel like, oh, great, you think we can't handle it? Or do you think our baby's not perfect? Well, this is what's normal. Let's prepare you for that.
Yeah. And I think many care providers have, a little bit in this. We don't want to overwhelm the parents, or we don't want to give bad news or telling them, oh my gosh, this will be hard when once the baby's here, you will never sleep again. You will only breastfeed 24/7 and not do anything else. And we don't want them to feel like overwhelmed before even the beautiful journey has started, right? So it is really good to find a balance of how do we do this. And I like the approach that you mentioned, giving them a toolbox so they are equipped. If you don't need it, great, fantastic. But so just in case, you have that and you don't feel as overwhelmed as if you were just not equipped at all.
Yep. I definitely have heard from clients who said, I really loved your class because I felt like when it hit, I knew what to do. I knew who to call. I knew that this was normal and that wasn't normal, and how to advocate. And even if they didn't know how to fix it, they knew it could be fixed or it should be fixed. And that was power. So I've definitely heard from clients who say, learning that made all the difference later. And it helps me be more passionate about continuing to educate, even when sometimes people feel like, do I really need this? Well, you might not need it with this baby, but you might need it with a future baby.
Absolutely. Yeah, absolutely. Yeah. Every baby is different, absolutely. Before I let you go, Kimberly, what are your last words of wisdom for us here?
What I would say is new parenting is going to be a lot more difficult and a lot more wonderful than what most people think, right? The sweetness is palpable, but the stress on parents is also palpable, and preparing for that is worth it for them and for their baby.
Absolutely. Well said. Thank you so much, Kimberly Bepler, for sitting down here with me, chatting about the upcoming presentation titled Understanding Infant Crying, which is part of the Clinical Tools for Changing a Landscape of Newborn Care, and which is an add-on package to our midwifery conference that will start February 6th. So thank you again for sharing your knowledge and your skills here with us at Gold and talking to me here today, Kimberly. Thank you so much for that.
Thank you.
And for our viewers, if you would like to find out more about this presentation and all the other presentations in the lecture pack and in the Midwifery Conference, we invite you to visit goldmidwifery.com. Thank you, everyone, for watching, and have a wonderful day. Bye-bye, everyone.